The financial statements are presented fairly in all material respects in accordance with GAAP. So that's the good, clean opinion that everybody's looking for. If we could turn to the next page real quick. This is a snapshot of your financial condition as of September 30, 2019, close of business. This is the statement of net position. So this is the full accrual long-term perspective. It's going to include things like capital assets, long-term debt, if there was any, compensated absences, your liability for pension liabilities, that kind of stuff. So a couple things I want to point out on this page is the two circle numbers up there towards the top, the current ratio, which compares your current assets to your current liabilities. In other words, how easily you're able to pay your liabilities. You guys currently have a current ratio of about 4, which is good. Anything over 1 is good, I guess. Last year you were at about 3 times, so this year you got 4 times more current assets than you have current liabilities, so you're able to pay your debts when they come due. Next thing I want to point out here is the positive unrestricted net position. It's positive $896,735. Last year, this number was a negative $771,401. So definitely a turnaround this year. A couple things I want to point out on this page also, I guess, is not necessarily any notes on the page, but your liability for pension liabilities, made up of 3 things. The deferred outflows of resources, right around the middle of the page, the $1,463,000. Then also the net pension liability down about 2/3 of the way down the page, probably the $2,937,000. And then also the deferred inflows of resources, $209,893. Those 3 numbers combined to be essentially like your net liability for pension benefits, and that overall has decreased this year by about $33,605. So it's kind of led to a little bit of an increase in your net position. And if we could turn to the next page.
Dan?
Yep.
You're saying that our net position and our pension has improved by about 33,000. Is that what I heard you say?
Overall, correct. Yep.
All right. If I read correctly, later on in the report, back in the notes, it indicated that we contributed about an extra $325,000 into our pension this year or 19 over 18.
Correct.
So what that means then is that our investments didn't come anywhere close to earning what MERS said they were going to earn.
That is correct.
Okay. All right.
Yep.
So we put in an extra 325 and all we did was go up 33,000.
Correct.
Okay. Thank you.
If we could turn to the next page. There we go. So this is the statement of activities. It's kind of the results of operations for the fiscal year. Again, on that long-term full accrual basis. So it's going to have things in there like depreciation expense, recognizing the increase or decrease in your compensated absences, the effects of those pension liability items. How we read this one is we're going to read it from left to right, beginning with the expenses, and then factoring in the program revenues to give us the net revenue or expense of those programs. That's going to show you how each of the programs are kind of self-sustaining or how they're supported by direct charges or grants. And then we're going to read it from the last column there, from the top to the bottom, to show how the programs are supplemented by the general revenues, such as the county appropriations. Bottom line here is that your net position for the year as a total increased $1.6 million. This is the second year of increases following at least 6 years of decreases prior to last year. And if we could turn to the next page. This is your governmental fund balance sheet. It's also a snapshot of your financial condition on 9/30/19, but it's more of a short-term current resources focus. It ignores things like capital assets, compensated absences, pension liabilities, all that stuff. It's just your current financial resources. Big thing I want to point out here is just the unrestricted, or I guess what we consider to be the unrestricted fund balance. It's made up of the assigned fund balance and the unassigned. Those two box numbers are at the bottom. It's about $2.2 million, which represents about 34% of your annual expenses, which is about 600 or 6.5 million. So you're at about 34% of your annual expenses in fund balance. Last year you were at about 18%. The GFOA recommends about 17% to give you about 2 months of expenses in fund balance for cash flow needs. So you guys are certainly in a healthy position.
Okay, Dan?
Yep.
Bruce again.
Okay.
In the 2,265,000, is
Okay.
the money that we got back from the feds for our county health plan included in that number?
Would that be the Medicaid cost-based reimbursement stuff, or no?
No. We got about $500,000, didn't we, Rebecca?
It was 300 some thousand. Teresa, where's it at on here?
I'm sorry, what are you looking for?
County health plan funds.
It is approximately 300,000.
Okay.
Do you know when those came in?
2 years ago. It wasn't this past year.
Okay.
I want to make sure, Dan, that the 300,000 is not in this 2,000,003 figure that you've got, because that 300,000 we can't spend any way we see fit. There's restrictions on it. I want to make sure that you pick that up in your audit.
Okay. If you haven't spent it yet, then I guess I'm assuming that it's going to be in one of these two numbers. If it's still in fund balance.
Okay. So really, instead of 2.3, 2.265, we've got 1.9.
1.9.
Is that what we're saying?
I believe so. If that's the case, yes. Let me make a note of that, and we'll see if we can back that out next year if it's still there.
Well, a lot of the funding that is in that number does have strings attached to it on how we can spend it. I mean, a lot of that money does.
Of the 2.2, Teresa?
Yes, because a lot of that money is Medicaid cost-based reimbursement money, and we
Okay.
can technically spend it any way we want within certain programs. So it's kind of hard to classify it when you say we can spend it on anything we want. We can, but only in certain programs. And that's kind of the same as the community foundation money. We can spend it on anything we want, but only for specific purposes.
Okay, so I guess, Dan, what I would like to see in another year is I'd like to see it broken apart, because we do not have 2.3 million that we can spend any way we want to see fit. It is not unrestricted.
Okay.
The Medicaid money we're getting has got restrictions on it. This county health plan money's got restrictions on it. And I think for the public to read this document, they think we've got 2.3 million that we can spend any way we want. And the first question is going to be, well, good grief, why do you need all that? And it's
kind of misleading.
It is.
Okay.
Teresa, is it also that this particular year, because we were receiving makeup payments for Medicaid cost-based reimbursement, that number's so high?
Yes, that is a significant reason why that number is so high, is because we received so much money from those back payments that were from 2 previous years in 1 year.
Could a note, Dan, could a note be attached to this? Could you do a little bit of research on what we have in each of those pots, and a note be attached at the bottom of this page to indicate how much of that money is restricted?
We can look into it, sure.
Okay. The reason I asked, Dan, is because back before I came on the board, if I understand correctly, the health department had a large fund balance. And so the health department was told by the board to spend that fund balance down to make it more reasonable, because the counties were hurting for money and they were cutting back on what they were given. So I want it accurately described here so that the health department doesn't run into this same situation in the future.
Okay.
Thank you.
Appreciate that, Commissioner Caswell.
I'm not always a bad person, Rebecca.
Never.
Next page. And this is where part of that Medicaid cost-based reimbursement shows up. So overall, for your results of operations at the fund level here, total revenues this year was $7.6 million. Last year was about 6.5 million. So looking at an increase of about 16%. And your federal and state revenues increased about 1.5 million, which is that Medicaid cost, partially that Medicaid cost-based reimbursement. You received about 1.1 million this year for 17, 18, and 19 reimbursements. Expenditures, 6.5 million this year versus 6 million last year, so an increase of about 8%. No real huge increases here, mainly in salaries and benefits, the personnel costs, and then a little bit of a reduction in contractual costs. Bottom line for the fund level was you increased your fund balance by about $1,060,000. Last year you had increased by about 500,000. So again, a large part of this year's increase in the fund balance is that Medicaid cost-based reimbursement that you received for about three fiscal years worth. Next page is a bar chart representing the past 5 years of operations for the health department. Just kind of showing, I guess, revenues have exceeded the blue lines there, have exceeded the expenditures, the purple lines, in the past 3 years. So you've kind of added to your fund level fund balance in the past 3 years. Next graph is a pie chart showing how the makeup, I guess, the composition of your revenues and expenses for the 2019 fiscal year. As far as the revenues go, the top graph there, biggest swing being in the revenues, changed from about 65% last year to about 76% this year, largely because of that Medicaid cost-based reimbursement. Charges for services have decreased from about 12% to about 9%. Everything else is relatively consistent. The other went from about 7% last year to about 1% this year. As far as your expenditures go, the bottom pie chart there, again, relatively consistent, a little bit of a little bit of a decrease in the salaries and wages as a percentage, went from about 40% to about 38%. An increase in the fringe benefits from about 17% up to about 21%. And a slight decrease in the contractual from about 18% down to about 16%. So a little bit less contractual work and a little bit more salaries and benefits. The next chart here is a comparison with a couple of our other local health departments. Management has just requested that we've kind of had a comparison with other health departments. So I won't spend much time on these, but I'll leave those for you guys to look at just to see kind of where you might compare, I guess. That's the same way with the next two charts, one being, again, the total revenues, expenditures, and increased changes in fund balance, I guess. And then also the last graph there is the total fund balance as a percentage of the expenditures. Last page, we did have a single audit, an audit of federal expenditures this year. The full CFA, the full schedule of expenditures of federal awards, can be found on page 41 and 42 of the full audit report. Total federal awards expended this year was about $2,746,207. Of those programs, we tested the Public Health Emergency Preparedness Program and the WIC program. And we're happy to report that there were no reportable conditions, no findings reported for either financial reporting or for federal awards. So nice clean audit, no reportable conditions, no findings. That's all I've got for you. But if you have any questions, I'd be happy to try to answer them.
Are there any questions for Dan? Okay, Dan, well, thank you very much. We appreciate your time this morning.
I'll make notes of taking a look at those fund balance numbers and see if we can break those out, or maybe show them as being committed, restricted in the future if needed.
Thank you. That would be very good.
You're welcome.
Okay, next up is a health officer's report. So Rebecca?
All right. Let me make this smaller so I can look at my report. All right. I wanted to first take a moment to recognize the folks that work at Branch Hillsdale St. Joseph Community Health Agency. They have certainly pitched in, rolled up their sleeves, and worked very hard as this coronavirus issue continues to change. I can't say enough about how hardworking they are, how much they care about our community, and how frustrated they get when they see community members not heeding the calls of our governor to stay home and isolate. I don't know how to make that stop ringing, so I'm just going to keep going. And especially I want to recognize the leaders at the top that report to me: Teresa, Callie, Paul, Laura, and Dr. Vogel. We can't do this by ourselves. We have to have a team. And I just felt a real calling to recognize them today. So moving on to program changes. Sorry, the phones are going to start blowing out. When I think about how much has changed in the past 2 weeks, it's just unbelievable, right? On March 12th, which was 2 weeks ago today, I was hosting a phone call with school leaders in the 3 counties to talk about things like, should we have a tournament game? Should we have field trips? You know, what should we be doing? And we fast forward into the following day, or that evening, I'm sorry, that evening, and we had the executive order released canceling schools the following Monday. And so that was just 2 weeks ago. We had no cases at that time. And look at where we are today. Things are very, very rapidly moving, as we had all been warned it would, and how, and of course, we've been trying to message in that way as well. As you know, we're currently under an executive order to shelter in place. And so the health department staff has been, some of them have been ordered to work from home. And we present to you today, the last page of my report is the staffing plan that we have come to. I will continue to report to the office 5 days a week so that I am here. The emergency preparedness coordinator will also report 5 days a week, but the other directors will be alternating days, so that what we're trying to do is keep 2 different teams of workers going, so that if team A becomes impacted by this disease, we'll have team B to fall back on. And certainly we still have the people that are exclusively working from a home base at this point. We do have 43 deaths reported as of yesterday in Michigan. And as my staff was going home yesterday, they observed people out playing softball, several families out playing softball in the baseball fields, kids playing basketball, several kids huddled around each other playing basketball. People are not taking seriously the shelter in place order. And the longer they refuse to take this seriously and not stay home, the longer it's going to take for us to come out of this catastrophe to our lives and our businesses, and will continue to hurt all of us. So for any media that are on the phone today, the message that we absolutely have to get out there is that people must heed the order. Yes, they can go out and get groceries. Yes, they can go out and do what they need to do, but they don't need to take everybody in their family to do so. We need to get smarter about how we interact during this time of crisis. All right. I shared with the commissioners some health officer orders that are starting to come out from other county health departments in Michigan. The Michigan Public Health Code provides the local health officer with broad powers to protect the citizens within its jurisdiction. The orders can accomplish these protection measures to mitigate an imminent health threat. However, to make such an order in Branch, Hillsdale, and St. Joseph counties, I would need the support of the local county commissions, county administrators, law enforcement, and others, including prosecutors and such, or there would be no point in making an order here. The most recent two counties to issue orders are Oakland and Washtenaw, which have both issued orders that require essential work, essential employers that are employing essential employees, to screen their employees every day when they get to work, to ensure that those individuals are not displaying any symptoms of COVID-19. After today's board meeting, there will be a session on COVID-19 that Dr. Vogel will provide. I hope you can stay for that. It is very informative and very, very sobering. Board of Health binders will be no more. I have had the IT folks create a place on our website for Board of Health information and documents. That is at the resources tab on our website. And then on the right-hand side is a listing of different resource items. One of the listings in that column is Board of Health. If you click on that, you will find documents in there that are specifically for you. Others can certainly see them, but we will no longer be maintaining those 3-ring binders. We'll put your documents in that space. Our strategic planning is essentially at a total pause due to COVID-19. The staff is tremendously overwhelmed, and we are not making any progress on that right now. We did get some emergency preparedness special project funding. I mentioned that previously. I was able to employ a temporary part-time worker for this project. His name is Leonard Robinson, or Lonnie. Lonnie is a PhD who just was sick of sitting at home and wanted something to do. He does have training in this type of work, and it's nice to have him here. He's doing probably really mundane stuff, but very important to us, and that's updating databases with contact information, and we are glad to have him on board. As an interesting side note, Lonnie's wife once worked for our health department. This was quite a number of years ago, and so we are glad to have him join us. The hepatitis A outbreak carryover funds, the agency did receive $25,000. We did, I did confirm that with Teresa this morning. So those funds are available to us. Our plan for use of those is to replace some aging equipment for vaccine storage. With regards to our leases, the Hillsdale one is still hanging out there. We've got some time on that. The last payment will be made in August. Our facility in Coldwater, that lease, we need to decide, and I guess I'm suggesting that we accept the county's offer to continue the lease at the current monthly rate. There would be no increase in that rate. The lease does have the health department paying 60% of building maintenance costs. And just so you're aware, the parking lot does need some repair, replacement. And we've been advised by the county that when the new jail has their new parking lot constructed, that they will do the health department parking lot at the same time. That will be a significant cost for the health department because we will be asked to pay for 60% of that cost. The other thing that we've been trying to work on with County Administrator Norman is the securing of additional square footage for our AAA 3C team. Unfortunately, this COVID-19 thing has taken all the oxygen out of us making any progress on that with the administrator. We'll need to get back to this. We're going to have to do something with this lease because it is expiring. And then with regards to the Sturgis space, we updated the information that we had last month. It's in your packet today. And I would like to move forward with authorizing the landlord to expand that space in Sturgis. We can make that happen with the additional funds we're getting through Medicaid cost-based reimbursement. And this is a good place for those funds to go. But I would like your blessing to move forward with that. In regards to health promotion and education, the health educators have been working on the annual report, the medical marijuana grant, helping me with some press releases. And I do have one health educator that will be going out on maternity leave soon. Finally, the plan was the other document that was provided today. Can that be shown on the packet, Teresa? So this is the essential services staffing plan. Don't really have anything more to say about it than to ask if you have questions.
Are there any questions? Let's start with the essential services staffing plan. Are there any questions on this document that Becky has prepared for us? I personally think it's very well thought out and very well explained.
Well, this was a team effort. The directors got together with me and this is what we came up with. So I don't want to take total credit.
Any questions on it?
No, except this is Commissioner Pangle. Everybody's done an excellent job in stepping up, and it looks like a good service plan to me.
Anything else?
Do we want to talk at all at this time about the feelings you guys have with regards to orders coming from the health officer?
This would be for all of you, just to remind you earlier about, it would be, Becky wrote in here, an order that I believe would be helpful would require screening of employees by employers daily for COVID-19 symptoms. Now, if we put that in place, then basically it would have to be enforced, I guess, by law enforcement. Is that correct?
Right. We
Okay.
would
Have you talked to the law enforcement agencies to verify? This is Commissioner Norris. Have you talked with law enforcement agencies to verify that they will actually enforce that order?
No, and that's, I wanted to start with all of you because if I don't have commissioner support, I will not have law enforcement support.
Well, I certainly would support it, Rebecca. I get frustrated because I see businesses right now that are functioning. They are non-compliant with the order. They're proclaiming to be necessary functions when in fact the particular business, as in here in Union City, there is a business out here that they make heavy equipment, items for heavy equipment, but apparently an arm of their business does make healthcare items. So they're proclaiming to be able to stay open by that way. So if they're going to do that, I want to make sure that people are getting tested and we're not spreading this any farther.
This is Commissioner Pangle. I totally agree. Right here in Mendon, we have a place that's staying open saying they need to supply a Whirlpool with washing machine parts and dishwasher parts for dishwashers. And I think if they're going to be able to find these loopholes and we don't have some type of enforcement, this is just going to continue to spread.
Mhm.
So I would support the order as long as you can get law enforcement behind you to enforce it.
Becky, Mark Wiley, in conversations with Doug Stanford as well as the sheriff, there's been some directives that have come down to them to refer any of this that we've just been discussing about businesses that are open that maybe shouldn't be or should be. That's to be referred to the AG's office. So I'm not sure where a health auditor falls in here other than, you know, we've definitely got a situation, but, you know, where does the AG's office and your office cross paths? I don't know the answer to that. So.
Well,
So
and this,
I'm sorry.
well, this is Commissioner Norris. I understand what you're saying, Mark, I do, but I think that if these people are gonna stay open regardless, because there is a way for you to complain about it, I get that. But in the meantime, we have all of these people coming in one place, and they need to take precautions, whether they're legitimately open or not. They need to be taking precautions to make sure that they're not doing anything to spread this disease any further.
Yeah,
I think the Commissioner Pangle, I think the AG is overloaded right now and can't act fast enough. So I think our counties are going to have to take a little bit of control.
Mhm.
Becky, would the health department have, because I know one of the things that would fall into this as far as screening the employees would be taking their temperature. Does the health department have those thermometers that these businesses could use? Because the availability right now is limited.
We do not. We're struggling to have thermometers to test our own staff.
So that'd be one of the problems if we issued such an order, is how are they going to test them if they don't have the equipment?
It is a problem, and we can't get them right now.
Right. I understand that.
Well, let me ask this question, everyone. If we gave Rebecca our tentative support for this, predicated on being able to find the equipment for the businesses to test with, predicated on what Mark has indicated, that any violators are to be turned over to the AG's office, would that be something that all of you feel would at least give Becky the ability to move ahead with this if these things come true?
Commissioner Pangle, yes.
Commissioner Norris, yes. As a matter of fact, in addition to that, Bruce, I would say that she needs to start contacting local law enforcement and the agencies that be, in order to make sure that they will endorse or support our decision.
I'm not
Most
certain
definitely.
the AG's office would support a local order. I just don't know.
Mark, what do you think?
Well, I think Becky just hit on the key. I don't know if local law enforcement has got the resources right now. They're pretty swamped with other issues. If Becky can work something out with them and she can find the needed equipment for these businesses to screen people, then I'm okay with the whole idea.
Is Al on the phone? Is Tom on the phone? Okay, so all of you've heard what Mark suggested.
Excuse me. Al is on. Looks like he's muted. But
Yeah.
Just
Yeah.
touch his mute button.
And so
in
is
the
Tom.
corner. They need to touch their mute button that's up on the top.
There we go.
Can you hear me, please?
Yep,
There's
we hear
Tom.
you now.
Thank you.
Tom, hi.
Hey, Tom, go ahead.
Okay. My concern is that, thank you, Mr. Chairman. My concern is that perhaps the officer Burns to check with the key law enforcement officials, all three of them, before we send out any memo or anything, in my opinion.
Oh, most definitely.
Right, we've got to have their support. I understand that everybody's stretched to the end. This is Commissioner Norris, but I do think that if we support this and we can gain their support from it, it's something that we can at least move forward on.
Al?
I totally agree.
Al Baylog, are you there?
Al's
Just have-
shaking his head, but he don't know how to. he don't know
Right,
how to
in the
talk.
right corner, there's a mute button. If you look up on the top of your screen, touch your screen.
Okay, I just unmuted Commissioner Baylog is able to talk now.
Thanks.
Okay, so you can hear me.
Yeah, we can hear you.
Okay, because I don't see a mute button. Rebecca, I think your idea is a good one. However, I do not see how the manpower is there. On social media, they're constantly saying, and even on the evening news, they are saying, do not call the police to report somebody that's in violation of non-essential travel. They are also telling the police officers, do not pull anybody over, unless you absolutely feel that you have to. In other words, if they're going 15 miles over the speed limit, ignore it, okay? They don't want any more contact with people any more than we want to have contact with people. The problem that I see here in Three Rivers, there's still quite a few businesses open, but they don't appear to be very busy, with the exception of Walmart, Meijer, and Menards. Now, Walmart and Meijer, they have to stay open because of the groceries, and people do have to have food. Menards thing is building materials is essential. Somebody's water heater quits, it's got to be replaced. They got to have a new water heater. But what I'm seeing, my observation, is the whole family is going into the store. Okay, mom and dad and 6 kids. I think we could get more mileage from the health department telling these larger employers that you have to limit the amount of people that are in your store at any one time. And if that means somebody standing there at the door with a counter button, you can only have so many people in here, and they need to turn away families. In other words, mom can come in, dad can come in, but the 6 kids have to stay in the car. That to me would be the most proactive. But to have law enforcement start going like door to door and trying to force employers to take employees' temperatures, I mean, if we get to that extreme, it's going to take more than our local law enforcement. It's going to take the National Guard. I'm glad you can hear me now, because I kept doing this. Can you hear me now? Can you hear me now? And everybody ignored me.
Well,
Sure.
I appreciate all of your input.
so what am I hearing? Does anybody want to make a motion after you've heard everybody discuss all this? Does anybody want to make a motion to give Becky any kind of direction?
Well, I guess my comment would be that she contacts the law enforcement agencies. Well, actually, probably make it even simpler. The chief law enforcement officer of the county is the prosecutor. I probably would contact the 3 prosecutors and say, look, this is what I think we should do. would you put out, Mr. Prosecutor, along with me, would you put out this order that we want law enforcement to start doing this and see what kind of response you get from the 3 prosecutors? And if they're not on board, I don't know how you're going to enforce it, and nobody's going to get arrested or go to jail because the prosecutor's office is going to throw it out anyways. So, I mean, how do you enforce it? Our intentions are good, but how do you enforce it?
Right.
Well, because part of that, this is Commissioner Norris, part of that, and I understand what you're saying, Al, because I would view it as a civil issue. And the question is, if you're going to issue the order, what usually in anything that you do, you've got to have a repercussion. So what's the repercussion? Is it a civil fine that they receive? What happens?
Well, let me state this for everybody. I think what Becky was trying to get at here is this. Those businesses who are able to be open under the governor's order, what Becky, I believe, is asking is that those businesses each day when the workers come in, do a screening of those workers before they let them into the building to do their work. That's all she's asking. She's not asking to open up other businesses. She's not asking any of this other kind of stuff. She just wants employees to be screened one at a time as they come in. We have a gentleman here in Hillsdale County that has the disease, and he picked it up at work in Ann Arbor from an employee who came to work sick and passed it on to him. So I think what Becky's trying to get at is that. Now, Becky, am I correct or am I incorrect?
Yeah, you are correct. I think everybody's right though, with regards to the enforcement piece.
Let me ask this question then, Becky, and all of you. Let me ask this question. Should we even be concerned about the enforcement? If we simply put out a statement that says, for best practices, we believe this should be done, and send it to all of the businesses that are open, not even worry about enforcement or anything else, but at least make them aware that this is best practices to do this. Is that something that we feel is out of line?
Totally agree.
You could do that.
Mr. Chairman, I agree that point to be, instead of enforcing, inform them. And also we want to make sure that our private sector, we do not damage their reputation in this time of crisis. So we have to be a little careful when we go as health workers to enforce. It looks kind of bad, like you said. So in my opinion also is that what you just mentioned, to inform, then see where it goes, please.
This is Commissioner Pangle. I totally agree with that, but I also agree with what Alan said about the stores taking some responsibility. I've talked to some cashiers in stores, and they have people coming in, families just cashing in lottery tickets. They're not even doing any shopping. So I think the stores need to take some responsibility in how many they're letting in at a time.
Commissioner
But
Baker.
that's not the issue we're talking about right now. The issue that we're discussing right now is, do we want to inform the employers that best practices are to take your employees' temperatures and whatever other things Becky feels need to be included each morning when they come in. And if somebody's running a temp, to tell them to go home, don't come to work.
This is Commissioner Norris. That's fine with me.
Okay.
I honestly think that these places like Walmart, Meijer, Menards, they would welcome guidance from the health agency. I think they're looking for answers as well. This is brand new to them. So any information that we can get to them would be a positive thing.
I totally agree. Not just the businesses that are open, but also to these stores.
Becky, now is this thing that you're talking about just designed to work towards the employees that work in a particular business?
I think we can put together best practices. You know, it may not come out in the form of an order. It may come out in the form of best practices that the health department is requesting. all
Recommending.
employers use.
Recommending. Okay.
Yeah,
How does everyone feel about that?
So this is Mark.
Commissioner Pangle is fine.
Mark, go ahead.
I'm fine with it, but you know, the caveat here still exists of not having the necessary equipment to do the screening. And that's, I mean, the idea is great, but if we don't make the thermometers or the testing stuff available, how is the employer going to comply with the best practices? So it's kind of a, I mean, I don't
Kind of a
disagree.
catch-22.
I do not disagree at all with the best practices letter going out. I think that's excellent. But we've also got to be prepared to back it up to support them.
Okay. Any other thoughts? Okay, then can I have a motion to do, well, somebody present a motion for us to formally start hashing out.
I would move, this is Commissioner Norris, I would move that we allow our health officer to put together a list of recommended practices for local businesses who are open or who are dealing with, well, basically who are open, because you're talking about government agencies as well. And then to bring that back to the board when she has that compiled. I would not require, however, that we have a special board meeting for it, as long as all of the commissioners approve the language.
And that motion is just for the employees of the business, is that correct?
Well, I think it's for the business and its employees, but it's not just business. So Rebecca, you might be able to help me better here in how you want to put this, but I mean, because we have governmental agencies out there as well, who are making these decisions. It's not just our local businesses that are open or that have employees coming in.
Yeah, this would be for everyone that has essential workers. You know, I struggle with even how we would get that out. I mean, we can send out a press release. We can talk with the Chamber of Commerce and see if they can send it out to their members. We can certainly distribute it to the counties. Somebody's going to get missed.
How about the news station, Channel 3?
Right. I mean, we can send it out that way as well. Yeah.
It just, basically you're targeting all employers of essential services that are open today.
Mm-hmm.
Correct.
But I don't know where we're going to come up with a supplies mark.
Right. Oh, I understand that, but you see the dilemma.
Yeah.
Best practices are great, but if you don't have the equipment.
Right.
Well, at least, Rebecca, you potentially can recommend, if they have resource questions, I think they could probably call you. But if you have another way for them to contact the powers that be to acquire the necessary equipment, you could certainly present that to them. So I think that you could give them a phone number to call or an email address to go to if they have questions.
The supplies are just not out there, though. We can't get them.
Right.
Okay, now, no, this is off the point. Okay, so we have a motion to allow Becky to write up a best practices sheet for employers to use on their employees each morning as they come to work. Essential business employers.
Correct.
And this motion would be predicated on being able to find the equipment to get to the employers so that they can follow the best practices. Is that what I'm hearing?
Well, this is Mark. I don't think we have to predicate the motion on the equipment. The equipment's as part of it, but the motion to get the letter out for best practices, I'm supportive of that. I just know that, you know, the hiccup's going to be the availability of supplies. So,
Okay, okay.
but we
Okay.
definitely need to do the letter, and I am supportive of that, and I support the motion.
Okay. All right, so that'll be just the motion, nothing in it about supplies. And the motion will be just for those essential businesses that are open right now. And this will be best practices for their employees coming to work each day. Is there any other discussion? Okay, now we have the motion. Do we have a second?
I support, Mr. Chairman.
Okay, Tom
Pardon me.
supports.
One moment. So is the motion for best practices for employees, or is it best practices? Does it say anything about screening employees? Just
It
want to
will-
make sure I have it right.
The best practices that Becky writes up, I would assume, would indicate that they should screen their employees each morning when they come to work.
Okay, so it's just best practices, nothing about screening. I have it. Thank you.
I have Commissioner Baylog, I have a question. Dr. Vogel, would you like to weigh in on this? Any thoughts from your perspective?
I think after you see my report, you will have a lot of answers.
Okay,
But
thank you.
I support what's gone down so far.
Okay, thank you.
Anything else? Okay, all in favor of the motion signify by saying aye.
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 Could I interject one moment, please? Our attorney has advised that all votes on
Roll
motion
call.
be by roll call because it's a
Okay.
video meeting.
Okay, roll call vote. Go ahead.
Commissioner Caswell,
Yes.
Commissioner Wiley,
Yes.
Commissioner Norris,
Yes.
Commissioner Matthew,
Yes, please.
Commissioner Pangle,
Yes.
Commissioner Baylog.
Yes.
Thank you.
Okay, now in your report, Becky, I think there was one more thing that you wanted us to look at. Oh, the Three Rivers Sturgis fleet.
Right.
You need our permission to request you to authorize it to enter into an agreement with the landlord for this expansion?
Correct. Can
Okay,
you get to that page, Teresa, on the board packet? Was this further down in the agenda, Teresa?
It is, it's under new business.
Well, I think you just blew by it. Right. Right there. Teresa, I'm having a hard time seeing it. Can you explain it, please?
So the first part of the document, that's the box at the top is what we are currently paying, and it started on year 1 and goes through year 10. We are currently on year 3 of that agreement. So the second box down would be the cost for the additional space. And this, what you see in the second column in from the right is the cost per year. And the third column is the cost per month to add that additional space. So if you look at right here for year 3, this would be, if we had the space for the entire year, it would cost us an additional $4,591.70 or $382.64 a month. If you look at this area down here, the bottom box, you'll see it starts at year 3 and goes through year 10 because we are currently in year 3. And this is for the total combining the top box and the middle box. So this would be the total for the space for the newly expanded space and the current space together combined. So for year 3, it would be $972 per month that we would pay to have that space. Year 4 would also be $972 per month, and it goes on up from there. And when it maxes out at year 10, it's $1,131 per month.
So the only
Wow.
thing I would say is that the landlord here is giving us this space at a significantly reduced cost per square foot, as you can see in that one column. You
Which
know,
column, please?
the third
The third one.
yearly cost per square foot. So, you know, the cost per square foot for commercial business is significantly higher than what is here. The landlord is friendly to the health department because they understand our mission, and that funding for us can be a challenge. And so they've worked with us to allow us this opportunity at a significantly reduced rate.
Okay, do I have a motion to approve this expansion, authorization to expand?
I would so move.
Is
Commissioner
there-
Norris.
Okay, is there a second?
Commissioner Wiley, support.
Okay, discussion. Tom?
Yes, please. I am for expansion, but my point is that this, we have the information here provided a month ago. I have asked for 4 questions, and is the finance committee had any input into it to advise me as a commissioner to support the program? Again, I want to reiterate the fact that I am for supporting, but I like to know more about that, please. For instance, the first year, how much is the total cost for the new plus what we have now? So first year, the second year, the third year, because time like these, I know we have money available from the immunization programs, and we have the flexibility. That is correct. But I would like to know the finance committee, what you think about, so I can go ahead and support you. Thank you so much.
So we didn't ask the finance committee to meet about this. The information we provided today, we tried to help say what the additional cost would be per year.
Yeah, if you look at the additional space which is the box in the middle, the cost per year, it says year 3, but that is the year of the lease that we are in. So they're going to add this space into the current lease, which was a 10-year lease. So year 3, the additional cost would be, if we had the space for the entire year, which we won't because the year has already started, it would be a total of $4,591 additional per year. And the same cost in the following year, and then it goes up to $4,830 per year more.
In year 5.
Yes.
You follow that, Tom?
Yes, I have, but I do not want to take your valuable time on this. However, I am very concerned because we are putting people's dollars, tax dollars, into work without the finance committee really to think about. We don't need a meeting for that, at least to think through whether we need a 5-year contract or 10-year or 3 years. We are putting the money for a brick and mortar. That is my concern. Again, I am new in this regard. I understand that. But when it comes to finance, I have a question. Again, I am supportive. However, I like to know what really here. Please.
This is Commissioner Pangal. I also have those same concerns. And when we go for 10 years, we don't know looking down the road what our finances are even going to look like in 10 years.
Right.
So
I agree, Commissioner.
our current lease is for 10 years. There is a clause that allows us to back out of that lease. But our current lease for that space is for 10 years. And we are in year 3 of a 10-year lease.
And if you back out, is there any kind of repercussions if backing out?
I don't recall there being any repercussions, Commissioner Pangal.
May I?
So my question, oh, go ahead. So my question would be, this is Commissioner Norris, because we're asking about these repercussions. So my question to you is this. We have an existing lease for 10 years on our 969 square feet. We're talking about adding 629 square feet. Say year 6, we find ourselves in a financial position where we can't afford all of that additional space. Are we going to be able to back out of the extended lease with the 629 additional square feet and maintain our 969 square feet? Or is it canceling everything?
I think it would come with, some changes to the layout and the construction to build that additional space into our current space to make it usable, which I don't know could be easily undone so just canceling half of it at that point.
And I agree with that.
Anything else? Okay.
This Commissioner Riley,
Go ahead,
Who,
Mark.
who sits on the finance committee?
I believe it's Tom and.
No, I do not.
Oh, I
Alan
am. I'm on
Baylog, I think he
finance.
does.
I do, Blaylock and Caswell. This is
So
Norris.
what is Alan's opinion and Caswell's opinion on the financially?
I'm fine with it. We need the additional space. There's no additional cost. It's not extending the lease any longer than what we're already in, so it's really not changing anything. It's not changing anything in terms of the lease. It's still 10 years and we're done. And if we have to back out for whatever reason, that won't be any different than what we're doing right now with the lesser space. If we had to back out of that. I think, personally, from a financial standpoint, I think it's a heck of a deal that you're getting that additional space for the same square foot price.
Right. Basically,
I agree.
you look at the 10-year and it's basically $5,000 more. And if we're in such dire straits that we can't cover that $5,000, we got a problem. So I think we're good.
Okay,
Bruce,
thank you.
Commissioner Wiley, Hillsdale County we actually paid for a square footage study on a similar building. And the results of that were, at that time, it was just under 2 years ago, but it was $10 to $12 a square foot. So to, just emphasize what Becky or Teresa alluded to earlier, this is an extremely good price. And we have some evidence to back that up. And so with that said, I'm supportive of it because we're getting quite a good deal. So.
Well, Mr. Chairman,
Yes, Tom.
with the efficient knowledge of you, the finance committee, you have said that it is fine, then I support too.
Okay.
Thank
All
you.
right. Anything else? Okay, roll call vote, Teresa?
Commissioner Caswell,
Yes.
Commissioner Wiley,
Yes.
Commissioner Norris,
Yes.
Commissioner Matthew,
Yes, please.
Commissioner Pangle,
Yes.
Commissioner Baylog.
Yes.
Thank you.
Okay, Rebecca, now I believe that took care of everything that you need out of your report. Is that correct?
I believe so, but may I please update you all on the number of cases? I did not do that when I was giving my report earlier.
Go ahead.
Okay, so I just wanted to give you our totals as of this morning at 8 o'clock. The total number of individuals that we are aware of being tested in Branch County is 15, Hillsdale 30, St. Joseph 37. That's the people we know about that are tested. There are people that are getting tested that we do not know, okay? So that's my caveat. Of those tests, we are still waiting for results on 7 in Branch, 16 in Hillsdale, and 12 in St. Joe. Confirmed cases, and this is new information as of this morning. 2 in Branch County at the prison. Hillsdale now has 5. St. Joseph County, 0. I will be updating the media once daily, at minimum, starting with today. I was able to, prior to this, keep up with sending media notices out when the cases came across our radar, but they seem to be coming much more rapidly now. And so I'll be notifying the media that at least once daily, there will be an update from the local health department, providing them with updated numbers. And that will go out today.
Okay, any questions for Becky on that? Okay, now Becky, I am assuming that the medical director's report will be at the end of our meeting for those who can stay online. Is that correct?
I believe that was the plan, yes.
Okay,
Can I respond to that? It's Dr. Vogel.
Go ahead.
My report, I don't have 2 reports. I only have this single report, and it will take about 10 minutes. So I can either do it within the agenda next, or I can do it at the end, your preference.
okay, commissioners, how many of you would like to have it done now? Say yes.
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 Commissioner Pangle, yes.
Okay, that gives us a majority. Go ahead, doctor.
Okay, what I'm going to do, I have to share my screen because I need my pointer. So I'm going to try this. See what happens. I don't know what that is.
I see the flag.
And now, can you see?
Yep.
Yes, please.
Can you see that?
We can see the
Yes.
map with the red dots.
Okay, we're good to go. All right, this information is dated mid-March with a couple of exceptions. The data is changing so quickly, I'm trying to keep it up to date. But bottom line is that this stuff here, that's us. And this is China. We're already there. So part of the question is, so why are we doing all this stuff, which is a no-brainer. This is China data with forced lockdown. And this is what happens when you don't. And the World Health Organization says that based on the data that they have, this is mid-March, the mortality rate is about 3.4%, which is about maybe 3 times that or maybe twice that of influenza. Here is where we are. And if you notice, this slope is continuing up. We have not peaked yet. We're still going up. If you look at this time, here's where China really took they got aggressive with their lockdown. But this is essentially a month or so. And then it takes about 3 weeks before you see any change. And we're still going up. This slide, I don't know how to get rid of that thing, but let's see if I can get rid of it. Oh, okay. if you look at, this is a busy slide and you've got it in your report. So the important part of this is if you look at this blue line, these are cases by date. Okay, and here's where the lockdown started. Notice this time frame is about 3 weeks before you see anything significant. But then this is China. The blue is China. It's significant. With a complete lockdown, it significantly goes down. And I think that's a very important point. I'll show you other data for this. This came from yesterday. This is data from the Kentucky and Tennessee. The difference with these is Kentucky is in the blue, Tennessee's in the yellow. As you know, Tennessee is not being real aggressive at locking down. So if you look at the difference just between these two states, look at the yellow. Because they didn't lock down, they're getting more and more cases. And you have to remember that the cases that they're getting are cases that have been tested. How many people are actually in the community with this disease spreading it, we don't know. But that's the difference between one state that's being aggressive, one state that's not. How contagious is this disease? And there's a number, this is a calculated number, and the number is based on the data down here is based on studies from South Korea and China. Okay, and so it may be inaccurate, it may be much higher than that. But just as a number, measles number is 12 to 18, which means if measles, a kid with measles walks into your house and then turns around, walks out, you've all been exposed. The Spanish flu of 1918, the number is, you can see 1.2, 2.8. That disease infected 500 million people and killed 50 million people worldwide. Look at the numbers for the COVID-19. We're there. Okay. The pandemic of 2009, significant less, 1.6 max. And seasonal flu is around 1, give or take. I mean, it can't be as high as 1.6, but much lower. Here is, and I got better slides of this. But the bottom line is that with shelter in place, this is China. Notice this line. This is cases. Here's the lines, what happens when you don't shelter in place, strict shelter in place. This is not just us, bunch of countries here, okay? And this shows you numbers of cases based upon what we are doing as a nation, not as we're doing within a city or a county or a state. This line here is the doubling rate. How many days does it take for this to double? Okay, this line here, that's 6 days, and look where we are. Now this is older data because we haven't beat Italy yet, and we were going to in a pretty quick period of time. But notice is that the doubling rate, this cases, and the data doesn't reflect active cases. It really reflects how many cases have been discovered. So if you notice this line here straight across, you're not getting any new cases. We're not there yet. Singapore and Hong Kong locked down much quicker, and their doubling rate is, they've really slowed it. Here's a lot of, and it's busy information, but and the height of this line is the number of cases. Okay, notice where we are in relation to Italy. Our doubling rate is just over 2 days. So every 2 days, the number of cases, either diagnosed or not diagnosed, is essentially doubling. That's why you see 1 case, 2 cases, 4 cases, 16 cases, because it's still active. And the fact that this line is going up is telling us we're not on top of it yet. Notice that China, they have the cases, but they're not going up. Okay, South Korea they realized the problem early on, and they've essentially locked it out at a much lower level. So these are not active cases; these are diagnosed cases. Okay, so here's a prediction of what happens if we do or don't do anything. And if you don't do anything, they're estimating, and I think these are coming from the healthcare experts. About 70% of our population is going to become infected. Okay, and if you don't do anything, April 4th, hospitals are going to be overloaded and we will not be able to adequately take care of people. If you've listened to anything on the news, especially in New York, they're running out of equipment, they're running out of ventilators. If you have somebody with severe respiratory distress, no ventilators, that person is going to die. And if you get to the point where you have to start saying who gets the ventilators, that's even going to be worse, because old people, they may not even be eligible for a ventilator based on their age. Okay, shelter, here's with social distancing, okay, you only get essentially another 2 weeks max, and the estimated deaths go down, but still, you're still going to overwhelm the system. And so obviously we can't do this. And the shelter in place for 3 months, I don't know whether we can do that or not, but look at the difference in numbers of people dying. Okay, this is, and again, this is a technical thing, but how contagious is this virus? To my knowledge, this virus has not mutated, but there is some evidence that this may become cyclic and it may mutate. If you think about the influenza, and this is not an influenza virus, it's a different virus. But if you think about the influenza virus, it mutates every year. So the flu shot that you get is not 100% protective based on the fact that this virus changes. To my knowledge, coronavirus 19 is not mutating yet, but these numbers are estimates, okay? And the important part of this slide is here's our ability to take care of it right here. That's nationwide. Now, some states may be better than others, but based upon these numbers, which again are actual, because we have actual numbers. If you look at the calculated value of 2.6, we will exceed that in about 20 days. And this is from the point of time they become symptomatic. And if you look at New York, we're real close to these numbers, somewhere between these two, okay? This growth rate, this is, and you see these things, here's the reason to shelter in place. Think of these curves as having the same number of patients. The same number of people are going to get the infection one way or the other. If they all get it at once, we're going to exceed our ability to take care of them. And you're going to have to ration care. And as it stands right now, that is going to be a critical shortcoming for the older people and the people with chronic disease. If you do something to slow the rate, not necessarily the total number, but the rate, we don't exceed our capacity to take care of it. The fact that we've already exceeded it essentially in New York would tell us that they're coming a little late in lockdown, okay? So the take-home message, if we don't test people, we cannot predict the infection or death rate. It's relative, but we are using data from South Korea and China, which is probably pretty accurate. But we don't have any idea how many hospital beds or equipment we need, because we don't know how many people are actually sick based upon US data, but we do have China and South Korea data, and the duration of this disease, we don't have a handle on, okay? Projections, because we're not locked down as a country, that's China, we mirror Italy, and Italy is in terrible condition right now. So public message, it's coming. It's coming at an exponential speed, and it may be gradual. It seems like it takes about a month after it's in your community before you start seeing cases. But once you start seeing cases, it explodes. Matter of days, maybe a week or two. Just think about at Branch County, 2 days ago, we didn't have any cases, and now we've got significant cases. And there's more in the community. Healthcare system will be overwhelmed if we don't do anything. More importantly is your healthcare workers are going to break down. They don't have equipment that exposes them to risk. They're being overworked. Once you start losing your healthcare workers, that's doctors, nurses, anybody who care, even lab techs drawing blood. Once you start losing workers, then we exceed that number of ability to take care of people very quickly. And the only way to do this is social distancing today, not tomorrow, today. If you don't do this, and those numbers, if you look back at those numbers where our caseload continues to increase, we can't get a handle on it. And the important thing to remember is it doesn't make any difference what Michigan does. Okay, we have control of that. Ohio is locked down, Indiana is locked down, Illinois is locked down. When we start going south or we go west, they're not. And the bottom line is just because they don't have the cases, and it may be a measurement, a testing as opposed to a real number, just because they have the cases does not mean that we are not in trouble. And so be safe for everybody. Maintain your social distancing, wash your hands, stay at home, keep informed. That's us. And that's my report. I'll be glad to answer any questions.
Are there any questions?
Just have to say that that's an incredible, scary report you just gave, Dr. Vogel.
If you think about World War III, because we're in it. Okay, World War II, we saw a bunch of bullets and stuff like that. But we're really in World War III. We have somebody attacking us worldwide. We have to respond to that as if it were a world war. The bottom line is that some of the health experts are saying this. So you get on top of it, and then it goes away and comes back again. And then we do this all over again.
I had somebody make a comment the other day to me that, as crazy as it may sound, you might as well accept the fact that you're probably going to get it. The good news is you probably won't die from it, but obviously there will be people that won't be as fortunate.
The estimates are about 70% of the U.S. population will become infected over a period of time. But realize that, let's say that the death rate is 4%. That means 96% of us are going to survive this. Now the question is will we develop long-term immunity? I don't think that's been actually researched. Certainly it appears that short-term immunity is there because they're using plasma from recovering people to treat the most sick. But how long that immunity will last, and if it becomes cyclic or mutates, are we going to be protected in the next cycle? We don't know.
Dr. Vogel, quietly. I understand that even the ones that survive it run a fairly high risk of permanent lung damage. Is that correct?
Well, if you look at the differences who are infected, a large majority, I believe, of 60% of people who get this disease are not sick enough to have to go to the hospital. So that they should recover completely. Of those who go to the hospital, about 40% of those hospitalized do develop significant problems, and about 20% of those end up on a ventilator. If you get to the point where you need a ventilator, you're probably going to have permanent lung damage because it causes fibrosis in the lung. It's a significant disease. But still, of the 90% who survive, at least 60 or 70% of those are going to recover without sequela. And you can't predict based on age. The old thinking that old people got it. It's now been shown that from age 20 to 54, 40% of the patients. And so all these kids are out there playing football and basketball. They don't realize is that they're at significant risk. And the other thing is if they get it and bring it home to granny, then that's a real problem.
Okay, thank you.
Other questions? Okay, Dr. Vogel, thank you very much for that very sobering report. The committee reports, neither committee met. We move on to financial reports. Can I have a motion to approve the payments?
I would move that we approve the payments as presented. This is Commissioner Norris.
Commissioner Pangle, support.
Okay, are there any questions on the payments?
I like how Commissioner Pangle and Commissioner Norris tell us who it is, because I keep thinking that it could be you, Bruce. Sorry, I just thought I'd throw a little humor in this morning on such a dark topic.
Okay, any okay, all in favor of the approving the payments? Let's have a roll call vote. Teresa?
Commissioner Caswell. I'm sorry, did Commissioner Caswell respond?
Yes.
Thank you. Commissioner Wiley?
Yes.
Commissioner Norris?
Yes.
Commissioner Matthew?
Yes, please.
Commissioner Pangle?
Yes.
And Commissioner Baylog?
Yes.
Thank you.
Okay, next up, we are going to review the financials. Teresa, go ahead.
All right, good morning, commissioners. So your packet after the bills, you will see the balance sheet, which looks good. And this is the page that you're usually the most interested in, which is our expenses by program. And you'll notice at the bottom, we are running right now at 2.4% over budget. And the reason that we are over budget is this MERS Medicaid pension payment. So we sent the entire year's worth of budget to MERS on the extra money that we were spending them that we had approved to spend. So we sent almost $600,000 to them, which is 97%. That's what's causing it to show that we're over budget, because we made a one-time payment for that money, which is a significant amount of our budget for the year. So that should come back into line when we get toward the end of the year. So other than that, agency support, you'll see, looks very high as well. And the reason that you have a problem with, or an apparent problem in agency support, is because the budget is under in so many other places. So the way that indirect, most of the stuff that comes into agency support is then spread out through indirect to the rest of the programs. And that indirect rate is determined when we make the budget. And it's based on wages and salaries. So when wages and salaries are low in the other programs, the indirect rate is not spread appropriately because it's low, enough money is not being spread out. So the indirect rate will have to be adjusted, which will bring RU10 back into line. So that will be adjusted, and the reason that it shows very high is because the money is not being spread to all of the programs because of the salaries and wages are not being spent in all the rest of the programs. So with that, any other questions?
When did we send this pension check off to MERS?
We sent that check in February, I think.
Okay. And I'm assuming that, do we know when they invested it? Because now's the time to have invested it.
We do not.
Okay. All right. Good enough. Other questions?
Teresa, is it in the payments for February? Because it'd be in this report.
No, it is. It shows up. Whoops. That's why this is $900,000.
Okay.
Hmm.
But I don't see, whoops, I don't see it there. Where's it at? I thought there were 3 pages of this. I think I'm missing a page.
I think you are correct. You're missing a page. There's only 2 pages.
Yeah.
Okay. Okay, that's fine. Okay, next up, we have under new business, the audit, and I'm assuming we have to, the audit that was presented to us earlier, Rebecca, is that correct?
Yeah, you need to vote to accept it and put it on file.
Okay, can I have a motion to do that?
Commissioner Wiley, I move we put the audit on file.
Commissioner Pangle, I support.
Okay, any discussion? A roll call vote, Teresa, please.
Commissioner Caswell,
Yes?
Commissioner Wiley,
Yes.
Commissioner Norris,
Yes.
Commissioner Matthew,
Yes, please.
Commissioner Pangle,
Yes.
and Commissioner Baylog.
Yes.
Thank you.
Okay, the next thing under new business is the Sturgis space, and I believe we've already taken care of that. Is that correct, Rebecca?
Correct.
Yes.
So next up, we have departmental reports, environmental health.
Morning, everybody. I probably just going to keep my report to the PFAS situation. Our adjusted services plan was already presented earlier. So I did want to give you updates on the progress of our PFAS sites. The one in Mendon is pretty well wrapped up. So we had the 2 homes that needed action. The one was connected to the municipal water a while back, and recently the other home had their filter installed, so they're all set over there. The site in White Pigeon, we've had a lot of activity going on down there. We've had a total of 19 wells that were tested. Of those 19 wells that were tested, we had 3 that tested over the health limit of 70 parts per trillion. And those homes are on bottled water. We had 12 homes that were under the health limit of 70 parts per trillion. And we had 4 that were non-detect. Eagle has decided that they were going to expand the study area due to some of the high numbers that we had down there. And they are going to expand to an additional 14 homes moving to the east. It appears that the higher numbers have been moved to the east of the plant there, so they're expanding their site to the east. At this time, the state has suspended all testing for PFAS sites unless it's an extreme emergency. So the White Pigeon site would fall under that they have suspended testing. So the 14 homes that have been identified, in the meantime, we made a decision this week to provide those folks with bottled water. And so we had quite a lot of discussion on that. Bottled water isn't necessarily how it's going to be available. I did work with a local grocer down there in White Pigeon, and they were agreeable to allow us to pay for a number of cases of bottled water ahead of time in a large volume, and then we could distribute vouchers to the folks that need the water. So we can mail those vouchers, they can turn those vouchers in, get their bottled water. So I was concerned that there might be a shortage of water available for those folks. So we also determined that we were gonna, that countertop water filters will be supplied to these folks. So it's a pitcher filter. It only filters a gallon of water at a time, but at least if there's a shortage of water for those folks, they will have some mechanism in which to have some filtered water. So that's where we're at right now. Once the Corona crisis is over with, we will, the state will get their folks in there to test those, and we'll move forward on that project. So that pretty much summarizes where we're at with our PFAS sites. I'd be happy to answer any questions that anybody has.
Are there any questions for Paul? Okay. Next up, we have the Area Agency on Aging. Laura?
Good morning, Board of Health members. Definitely a busy time for the Aging Network, as you can imagine. Luckily, our region is fully staffed, and so we are being quite busy, and the staff are having a really quick learning experience to get up to speed and be able to respond, but they're doing a phenomenal job. I couldn't be happier. Our symposium events had been canceled. We had a great response, so we're working to try to find new dates. Victim specialists have been busy, as I noted, working remotely and doing well-checked phone calls with all previous and current participants, and we have been seeing an uptick in referrals. I'm sure you've also seen and been a part of some communication regarding scams that are going on during these times. Scams and swindles go on the uprise as well. So we are busy making sure that our providers and network partners and community partners are aware of those scams and swindles too. We've been assured, and there is legislation that is passed to bring emergency dollars to the network. That should be coming to the states soon. We don't know how much we will get as a region, but we will be prioritizing that according to certainly the boilerplate attached to those documents, and to be able to refresh budgets that are overspent right now as a response to those greatest in need. The Branch County Meals Program, I'm happy to say they've been very adamant to eliminate their waiting list of more than 60 individuals, and have now are in the process of opening those participants up to receiving meals in their homes. They've added multiple routes and leveraged resources until the federal emergency funding comes in. So now, they're serving over 130 meals twice a week they're delivering. And so that is a huge relief to us as an agency, and I'm sure to our Branch County Commissioner. The participants will be educated on how to reheat those meals to assure that they can get them opened and understand the labeling and dating. And that the fact that they are temporary in light of this emergency situation that our nation is facing. We've been talking with and communicating regularly with our providers, sharing all of the tip sheets and resources that have come out. They are, doing what they can as fast as they can to try to meet the need and to try to bring new people into the network for receiving services. So we're hosting conference calls with them today and tomorrow, and going to be summarizing any unique needs or circumstances with our aging unit tomorrow on our regular call with the aging unit, Aging and Adult Services Agency. So I also, last night, I guess the Older Americans Act was reauthorized at the federal level. So that is super exciting and brings a lot of new guidance and hopefully some new funding into the network to help address ongoing need in our region. So that's a good news as well.
Any questions for Laura? Okay, thank you. Next up is personal health and disease prevention.
Good morning, everybody. This is Callie. I really do not have much to report on that Rebecca and Dr. Vogel have not already addressed. The main priority right now, agency-wide and really heavily in our clinic staff, is responding to and being on top of our Michigan disease surveillance system, those COVID-19 cases coming in, providing education to these people, and especially to those who are PUIs, persons under investigation, making sure that we are communicating with them and educating them on isolation and quarantine, working on any contact tracing that needs to be done, and then also keeping our providers updated with the ever-changing guidance that's coming through. And then I also just wanted to reiterate to everybody that we are here Monday through Sunday, 8 to 4, and we have implemented also an on-call staff for the evenings so they can respond to the needs of this pandemic. Excuse me. As far as our programs, WIC is by phone appointment only. STDs is right now for symptomatic patients only. We have suspended our immunizations at this time until the shelter in place is lifted. and then we will reevaluate if we need to start providing or if we can start providing those essential services. Our guidance for testing has changed. We've had some updates on that as well. The main priority for testing is hospitalized patients and healthcare facility workers with symptoms. And then the second priority are patients who are in long-term care facilities with symptoms, patients 65 years of age and older with symptoms, patients with underlying conditions with symptoms, and first responders with symptoms. And those symptoms are still, as you've heard, fever, cough, and shortness of breath. I think that is everything right now. Rebecca had updated you on our numbers, which are changing very quickly, by the minute. So we'll continue to update you on those. That is it for me, and I'm happy to answer any questions.
Are there any questions for Callie?
Yes, I have a question, please, just general. For our 3 counties, how are our first responders are holding, please, health-wise?
I'm sorry, could you repeat that? I had some
Absolutely.
background.
Let me turn this on. This is Commissioner Matthew. And my question is, how is our first responders, St. Joseph, Hillsdale, and Branch County, in number-wise, how they are holding health-wise, please?
I think in our area, I can't really confirm with you on that right now, but with the 3 counties that we have, we have confirmed 7 cases. So at this time, our healthcare providers are not as overwhelmed as some of those larger areas like Detroit in their hospitals. So
Yes.
I can't really give you, a number right now because they are responding to patients who are hospitalized with COVID-19. But I think right now we're probably a bit more well off than those in those larger communities. But as I'm sure there are a lot more cases out there that have not confirmed and that we are unaware of at this time.
Callie,
I
can I
thank you. Thank you.
respond to that, Callie?
Go ahead, Dr. Vogel.
Is it, I believe that there is a sheriff in St. Joe County that is in quarantine right now.
Oh,
I believe he has tested negative and has minor symptoms, but he is in quarantine. I believe he's got a week to go. I know I've been talking to Amy and Three Rivers about that. So that's something I know about.
Thank you, Doc.
Commissioner Baylog here. It's not somebody from the Sheriff's Department, but it is a county official and still is reported as negative.
Any other questions for Callie? Okay, I would like to take the opportunity here at the end of the meeting to, on behalf of the board, to thank you, Rebecca, Teresa, Callie, Paul, and all of your workers. It's been a very stressful month. You guys have done a really nice job. It's frustrating to be in the position of telling people what to do and then not having them do it when you know the outcomes that are going to happen. But your professionalism and your dedication and your work ethic have been outstanding in everything that you've done. And I truly and deeply appreciate all of your efforts. And when this thing is over, I think it would be entirely appropriate for all of us to be thinking about how we can thank not just the leadership, but all of the members of the health department for all that they've done. The other thing that I want to mention, and it's just starting to come out, and you all need to think about this, commissioners. If we're not going to lock down, you can see what Dr. Vogel told us. And you can see the cases continuing to go up. Now we're in a quandary. To lock down means to basically shut the economy down. The economy shut down long enough, it doesn't come back. And then we get into a depression type situation. But if we don't social distance and lock down, then the disease spreads and more people will die from it. And we know mostly that'll be older people. So the quandary that we have, and we're fast getting there, this stimulus package that's been passed in Washington will buy us time to get money into people's pockets. It'll keep them afloat 2, maybe 3 months. And after that, a decision is going to have to be made. Do we keep the economy shut down with all the damage it's going to do to a lot of people? Or do we start opening things back up and accept the mortality rate that we know exists with this disease? And it's certainly not an easy decision for any of the leadership in our country, whether at the state level, or the national level. But if we're not willing to social distance and we're not willing to lock down and stay home and so on to do our part to reduce the number of cases, that's the decision that we're making. And I think as you talk to people, you need to emphasize to them, not following rules now will lead to this decision later. And be very blunt. I know I tend to be too blunt sometimes, but you got to be very blunt with people because a lot of people still don't get it. They don't understand. So with that, I would open it up to any other comments before we adjourn from any other commission members. Mark, do you have anything?
Well, I'd like to share. I'm looking at statistics by county right now. And, you know, the greater Detroit area is where it's kind of the epicenter almost for us. Wayne County with 417. And I can't see a date right now on this. So it might be even a little old, but Detroit City, 705. Oakland County is showing 543 and Macomb 281. Oh, you know, the rural areas are the light areas, if you will. So we need to keep it that way. And social distancing, as you indicated, is one way to do that. The other thing I wanted to mention real quick is I had a email pop up. I'm actually running off of 2 devices here, but Doug Sanford sent me a new executive order 20-25, I believe it is. So for those needing prescriptions, 20-25 is giving authority to pharmacists to or fill more than what they would normally fill, up to a 60-day supply on medicines. And then there's some other things in 2025, but I thought that was interesting that the governor's, you know, expanded the ability of pharmacists to, you know, assist. So anyways, that's all I've got.
Thank you. Terry, do you have anything?
Well, I support what you're saying. I understand what everybody's saying, and I support that. I want you to know that I'm doing my part. I do have a sign in my law office window that says that I will only have contact with people on an emergency basis. I basically shut my office down. It hurts me financially, but I think that it keeps my community safe by doing that. I have many people here that I see that they're just wandering about as if there is no emergency, when I think that there is concern. I believe that we will probably, even though I know the order currently through the governor is through the 13th of April, I contemplate that will be extended at least until May. So I do contemplate that we may be meeting this way again in April. And I would have no problem with that. So I just hope that people use common sense and be safe. This is not a vacation. You are in a stay home, stay safe situation. This is not a family vacation. I think that I see people viewing it that way.
Okay, Tom?
Well, thank you, Mr. Chairman. Along with you and the team, I am grateful for our Branch, Hillsdale, St. Joseph County Community Health family. And thank you for informing us citizens such a way that we do not damage our health of the economy as well as the communities, which you just addressed. And thank you for the information about that prescription. I was not aware of it. I sure channeled that to our communities whom I talked to. Another point I want to say is that, Mr. Chairman and the team, I have called our daughter and sons across the United States that how they conduct themselves. So I want to thank you. That's all, please.
Kathy?
Also, I'd just like to thank all the people that are stepping up at the health department. And I would like to say that it's nice that we could meet like this with this new technology. And it's even better that Bruce, myself, and Mark could figure it out so we can do this.
I might add in that regard, Kathy, that after Alan called me and helped me set all this up and everything, he was not in tears. He survived it quite well.
Okay, good, good. And everybody stay safe and healthy.
Okay, thank you. Al?
Oh, man, I think pretty much everything has been said. I think all of us in this board meeting at this moment probably has a better understanding than the average person that our lives do depend on what takes place in the near future with this pandemic. With that, stay safe. Let's keep each other in our prayers, and let's stay focused, positive. I think we will prevail. I think when it's everything's said and done and it is behind us, each and every one of us are going to be a better person. It's made life, more, I guess, fragile than we probably don't realize as we go about our day-to-day lives. So again, stay safe, and a very good meeting, and thank you, Becky, and all of your staff.
Okay, with that, Teresa, thank you for all this electronic hookup stuff, and Alan, same thing with you. We stand adjourned. Have a good day.
Thanks, Bruce.
Thank you, everybody.
Look for.
Hey, Rebecca.
Thank you.
Thank you.
Rebecca?
Something else.
Rebecca?
Yes.
Hey, Rebecca?
Yeah.
Can you get me can you send me in a separate email Dr. Vogel's report? I like to share his reports with others. I do think it gets the word out, and I thought that he had some very good information in there that would be very useful.
Absolutely.
Yes, I would like a copy of that too, if you could send it to me.
I can take
Thank
care
you.
of that, Becky.
Okay, thank you.
Teresa.
Perfect. Thank you.
Are you logging us out, Trace?
Yep, I'm getting ready to right now.
Okay.
Then I'm
Thanks.
going to call you.
Okay.